Hello everyone, welcome back to our channel Dentistry of Two Minds. Let's start with the oral pathology, which is a third year exam going subject in BDS. So we will be starting with the diseases of microbial origin. First we'll deal with the bacterial infections of the oral cavity. So there are various bacterial infections that occurs in our mouth. Scarlet fever is one of them. Today we'll learn about that. Scarlet fever is a contagious systemic infection that predominantly occurs in children, and it is caused by group A beta hemolytic streptococci. Streptococcus pyrogen, which produces a pyrogenic exotoxin. This disease begins with a streptococcal tonsillitis with pharyngitis, in which the organism elaborate a erythrogenic toxin or a scarlet fever toxin that first attack the blood vessels and produces a characteristic skin rash. A number of different strains of streptococci may produce this disease. The rash occurs because of three exotoxins, A, B and C. This organism produce a clear hemolysis around the colonies in blood agar plate. Local erythematous reaction with exotoxin, but no such reaction was found in those with specific immunity. So what is local erythematous reaction? So erythematous reaction is a reddening of the skin or a mucous membrane caused by accumulation of blood in dilated capillaries. Specifically, this condition is susceptible to the patient who do not have antitoxin antibodies. Various studies suggest that the development of scarlet fever may reflect a hypersensitivity reaction, that is allergy, requiring prior exposure to the toxin. The incubation period ranges from 1 to 7 days. Now let's talk about the clinical features. Scarlet fever is the most common in children from ages of 3 to 12 years. After the entry of microorganism into the body, which is believed to be occurs usually through the pharynx, there is an incubation period of 3 to 5 days. After the patient exhibit a severe pharyngitis, tonsillitis, headache, chills, fever, abdomen pain, malaise, nausea and vomiting. Accompanying these symptoms may be enlargement and tenderness of the cervical lymph nodes. The significant clinical findings include fever, enanthem and exanthem. What is basically difference between the enanthem and exanthem? Enanthem or enanthema is a rash inside the body. Example of this is the spots in measles inside the mouth that look like a tiny granules of white sand surrounded by red rings. By contrast, a rash outside the body is called exanthem. The enanthem of oral mucosa involves the tonsils, pharynx, soft palate and tongue. They become erythematous and edematous. And the tonsillar crypts may be filled with yellowish exudate. Tonsillar crypts are the small pockets or a fold in the tonsil that traps the bacteria and other harmful microorganisms. Tonsillar crypts are the natural feature of the tonsil, which are the soft tissue lumps on either side of the throat. They are formed when stratified squamous epithelium that covers the tonsil dips into the tonsil surface. The exanthamous rash develops within the first 2 days. The exanthamous rash develops within the first 2 days and becomes widespread within the 24 hours. Rash. The color of rash varies from scarlet to dusky red. This rash is particularly prominent in the areas of skin folds is called fascia lines. Fascia lines are the clinical signs that appears as a bright red or pink lines in the skin fold such as armpit, groin and in the people with scarlet fever. A bright scarlet rash starts on the chest and upper body and then it's spreading to the arms and legs but sparing the palms and soles. Subsides after 6 or 7 days followed by desquamation of the palms and soles. These scalings begin on the face at the end of the first week and spreads to the rest of the skin by the third week, with the extremities being the last affected. The rash usually clears within 1 week and then a period of desquamation of the skin occurs. The classic rash of scarlet fever is distinctive and often are described as a sunburn with goose pimples. Classically, in untreated cases, fever develops abruptly around the second day. The patient temperature peaks at approximately 103 Fahrenheit and returns to the normal within 6 days. The skin of the face usually is pale or may demonstrate erythematous cheek with circumoral pallor. Next is oral manifestations. The chief oral manifestation of the scarlet fever have been referred to as Stomatitis Scarlatina. Small punctate red macules may appear on the hard and soft palate and uvula. These are called Forchheimer spots. The palate and the throat are often fiery red. The tonsils and facial pillars are usually swollen and sometimes covered with greyish exudate. Most important changes that occurring in the tongue in scarlet fever early in the course of the disease. During the first 2 days, the dorsal surface of the tongue demonstrates that exhibit a white coating and the fungiform papillae are edematous and hyperemic, projecting above the surface as small red knobs. This phenomenon has been described clinically as strawberry tongue. By the 4th or 5th day, the coating of the tongue is soon lost, beginning at the tip and lateral margins, and this organ becomes deep red, glistening and smooth except for the swollen. When the white coating desquamates to reveal an erythematous dorsal surface with hyperplastic and hyperemic fungiform papillae, the tongue in this phase has been termed as raspberry tongue. In severe cases, the ulceration of the buccal mucosa and palate has been reported, but this appears to be due to secondary infection. So here you can see the picture of scarlet fever where the dorsal surface of the tongue exhibiting white coating in association with numerous enlarged and erythematous fungiform papillae, that is white strawberry tongue. Now let's discuss about the complications associated with the scarlet fever. Occasional complication may arise referable to local and generalized or systemic bacterial dissemination or to hypersensitivity reaction to the bacterial toxin. Local complications may include peritonsillar abscesses, otitis media, rhinitis, sinusitis, and mastoiditis, while the systemic includes rheumatic fever, glomerulonephritis, meningitis, pneumonia, and arthritis. Diagnosis is usually based on clinical findings, includes rashes, sore throat, and fever. Routine blood examination shows marked leukocytosis with increased neutrophilia. There is an elevation of ESR and C-reactive protein. Culturing the flora of intraoral lesions, pharynx, and saliva can be used to confirm the diagnosis. Throat culture is the standard for the diagnosis of streptococcal pharyngitis and scarlet fever. Although less sensitive than throat culture, rapid antigen detection, testing provides quick result and exhibit good sensitivity and specificity. If negative test results are obtained in children, then confirmatory throat culture should be performed. Treatment. The administration of oral antibiotic of choice of group A streptococcal is either penicillin V, amoxicillin. Other choices for penicillin allergic patient includes azithromycin, clindamycin, cephalosporin such as cephalexin and macrolides such as erythromycin and clarithromycin. Symptom management include ibuprofen can be used to reduce the fever and relieve the associated discomfort. Local applications like mupirocin topical ointment also can be used to relieve discomfort. Complication to prevent. Treatment of scarlet fever and the associated streptococcal pharyngitis is necessary to prevent the possibility of complications such as peritonsillar or retropharyngeal abscesses, sinusitis, or pneumonia. The late complications are rare and include otitis media, acute rheumatic fever, glomerulonephritis, meningitis, and hepatitis. Prognosis. The fever and the symptoms show dramatic improvement within 48 hours after the initiation of treatment. With appropriate therapy, the prognosis is excellent. Prevention. There are no available methods for the prevention of scarlet fever. So this is all about the scarlet fever. Hope you have understood well. Thank you. Don't forget to click on like, share and subscribe button and also hit on the bell icon so that you never miss on updates.